Hi, I'm Mary Thomas, and I want to welcome you to the first steps to relieving pain and increasing your energy level. These are also the first steps to finding better balance in your life and in your everyday tasks. I'm going to be giving you an overview of some information that you're also going to get in greater detail as you listen to future modules during this program. One-third of all Americans on any given day experience enough pain that it is limiting their ability to complete the tasks that they need and want to do. It also limits the amount of enjoyment that they find in those tasks and doing those activities. It's estimated that $6 billion a year are spent maintaining, controlling, or treating pain. But again, it's mostly pain management. I want to introduce some concepts to you that do more than manage pain as you continue to engage them over time. Just to make sure that we're on the same page, let's define pain and then talk a little bit more in depth about the details of what pain means and how that meaning can vary from one individual to another. So pain is a variable, unpleasant sensation associated with actual or potential tissue damage and mediated by the specific nerve fibers to the brain, where its conscious appreciation may be modified by various factors. That's a lot of big words, so let's see if we can break that down and make it understandable in our daily lives. A variable means something that varies. It's not the same all the time. So one activity may make the pain worse. A different one may relieve it. One day we wake up and we feel great and there's no pain. Another day we wake up and we can barely move. So the pain varies. It's an unpleasant sensation. I think everyone can agree that pain is unpleasant. But what we forget is that unpleasant can start out very, very small. Just feeling like there's some tightness in the tissue or some discomfort, all the way up to severe function limiting, movement stopping pain. Now, this unpleasant sensation is associated with actual or potential tissue damage. So what's the difference between actual damage and potential damage? Actual damage happens when the tissue is actually damaged. For example, you've fallen off the curb and you've sprained your ankle. That's actual damage. Or you've had surgery and they needed to cut open your tissue, your skin, in order to get to a deeper part of your body to try to repair something. So as a result, you've had actual damage. In a case of potential damage, that's more like I'm sitting on an airplane or even in a car for 2 to 4 hours, and I start to notice my legs swelling up. And my leg's uncomfortable and it's getting firm and it's harder to move my ankle. And I'm realizing that there's a potential for tissue damage. If I don't get up and move and do something about that swelling, I have an increased risk of having a blood clot in my leg, which would be actual damage. So it's really important to see that sometimes pain is the body's way of communicating with us in order to get us to change our course, to reduce damage or to shift damage that has already happened. The mediation by specific nerve fibers to the brain. What this means is there are specific nerves that carry specific information to the brain. Let's say you got burned, or maybe you got frozen, depending on what climate you live in. But if you got one of these, that information is going to the brain through the same nerve pathway. but it doesn't travel on the same nerve pathway as, say, having an injury where something fell on you and your toe got smashed. When your toe gets smashed, those are crushed nerves or pressure nerves, and they're going to send through a different pathway to the brain. And that's what it means when it talks about mediated by specific nerve fibers. Different types of sensations are carried on different nerves to the brain. So where its conscious appreciation may be modified by various factors. So conscious appreciation, that means how our conscious mind perceives the pain. So you can have two people who have the exact same injury or exact same actual tissue damage. So let's say they both had a rotator cuff repair on their shoulder. One person comes in practically in tears, and the other person comes in laughing and saying, yeah, it hurts. I don't want to move it too much, but they're having a very different experience. Now, some of that is due to the different ways that our neurological systems are set up and developed when we're in the uterus and we're developing as a person. But there's also that social, cultural, and learned aspect of pain. And that's why it says conscious appreciation. I've seen one individual who was raised in a family where if you had a pain, you immediately went to bed, you got lots of attention, it was a very big deal, even if it really wasn't that much tissue damage. Another person I know was raised in a family where it was like, hey, you'll get over it, it's okay. If you really hurt, you could take a Tylenol or an aspirin. But if you're still functioning and able to walk, you can't be that bad off. So these two individuals have completely different conscious appreciation for pain and how they're going to cope with it or how they're going to strive to address it and get over it. And each one of us has had specific experiences related to those unpleasant sensations that has taught us different lessons in relationship to pain. And because of that, we have a conscious appreciation that may be modified by many and various factors, including learning, our experience in watching those around us, our training, and professionality. Another example is if someone has a pain internally and they have a fear of having cancer because they watched a loved one pass away from cancer, they may get a lot of anxiety related to having this unknown pain. Now, they don't even know if the problem is actual, if it's potential, or if it has nothing to do, which is probably the most likely case, to do with cancer, but they can be very, very frightened by this because of their life experiences. So you can kind of get an idea as to how those modified factors can be so hugely varied from one person's experience to another. There's also two types of pain, acute and chronic. So in an acute situation, it usually serves as a warning. You need to rest, you need to change your actions, you need to protect the tissues. That's the warning you're getting. For instance, in the example of sitting in a plane too long, you need to get up and move. It is a warning. If you don't get up and move, there's going to be some problems and actual damage as opposed to potential damage. So please get up and move. So it's your body's way of communicating to you and sharing with you that it has needs that you might not have been aware of before it starts giving you that unpleasant sensation. It's usually a fairly sudden onset, which means 1 minute you didn't have any unpleasant sensation, and the next minute you did, because of you reach that threshold that your body has that says, okay, I could cope until now, but now I need you to change your behavior or action. Now, frequently when we first begin to feel that, we're kind of in this thought process of, you know what, it's not that bad yet, I'll live with it. oh, I don't want to be a complainer because I'm tough. So we don't do anything about that sudden onset and that message from our body that says, hey, you have a potential here for tissue damage and we need to take action now. We typically think we can slug it out, push through it, and get past it. The best thing you can do is listen to your body and make a small and simple change at that moment in time. Acute pain also tends to be sharp or burning. Now, sometimes it can just be pressure, but if you continue to let the pressure grow and magnify, it's going to turn into sharp or burning. It has a duration of less than 6 months because if you listen to that acute pain, if you respond to that message from your body, it's going to resolve and you'll never have to get to the next stage, which is subacute or chronic pain. And acute pain is usually fairly easily resolved with treatment of the cause. So if I had surgery and I have acute pain, the treatment would be to let it rest enough to let the tissues heal while gently moving and stretching them so that they heal in the best position for those tissues. It also, for an ankle, to give it a few days rest and then gently begin to slowly stretch and mobilize those tissues by moving the foot and ankle up and down or moving that joint involved only to the point of mild unpleasantness so that those tissues begin to stretch and move slowly and easily without forcing them. Now, in the case of chronic pain, it can begin in many different ways, all the way from dis-ease or disease, which can include a rheumatic disease such as lupus or rheumatoid arthritis. It can also begin as an acute pain that isn't addressed or properly cared for. It's not treated with correct treatment or consideration of those tissues, and as a result, those tissues become chronically inflamed and painful. So pain can become called chronic somewhere around the 3rd month, but frequently it isn't until closer to the 6th month. There's a category in between acute and chronic called subacute, which I'm not discussing for the points of time and simplicity, but you want to be proactive and you want to be on top of treating acute pain because the sooner you treat the pain appropriately, the less duration or the less long typically that pain's going to last. Chronic pain can last for months to years, and sometimes the cause of chronic pain is never able to be clearly determined by your physician. And it is more difficult to treat than acute pain and typically has what is called an insidious onset, which is a slow onset. Like I was talking with the acute pain, you have a little pain and you go, oh, I can ignore this, I can drive through it. So then the next time you experience that pain, it's a little more severe, it's a little bit more function limiting, but you can still drive through it. And you keep this process going and you start that spiral where you get the pain, you get the triggers which cause the pain, which you try to address with quick fixes rather than addressing the triggers and looking for those triggers, which is some of the things we're going to talk about today in this module. So because chronic pain is a little bit more difficult to treat, we're going to discuss that further. So again, it can begin in multiple ways, including acute onset. So you have an acute pain which becomes chronic because appropriate and proper treatment or diagnosis was never made. It can also, again, be due to the dis-ease process of, say, rheumatoid arthritis, osteoarthritis, deconditioning syndromes, unmanaged diabetes. And it usually has an insidious onset, meaning slow and of unknown cause. There are times where no one's really able to delineate exactly what the cause of the pain is that someone's experiencing. But that doesn't mean that they're not experiencing that pain and that it isn't real. A great deal of my physical therapy practice is centered around individuals who are quite frustrated because they've been living with pain for some time and haven't been able to find a good solution for it. Another frustration of chronic pain is that our friends, family members, and even our healthcare providers get frustrated because they can't help us with it. They want to help with chronic pain, but they don't know how. And they don't know how to help you feel better or resolve the issue. And so it becomes quite easy at this stage to begin either blaming or judging, which compounds the issue. We're going to discuss that more as I go over the pain cycle in more detail. You begin with a pain. You're not sure why it's there, but you're sure that it's unpleasant and that you're tired of living with it, even if it's only 5 minutes. This starts to increase muscle tension. We start to splint, is what it's called in healthcare, and that is we start to tighten the other muscles that are adjacent to where the pain is. We start to breathe more shallow. We start to walk differently or raise our arm differently. And that's the changes in the movement patterns which begin to occur. Instead of taking full fluid steps with nice rhythmic movement in my trunk and arms, I start to take short, tense, and small steps. I go to the doctor finally, if I haven't already gotten medications at the pharmacy, and I get additional medications, and I take them. Most medications to treat pain, if the cause of the pain isn't known, only act as Band-Aids or quick fixes. They decrease the discomfort temporarily, but they don't actually resolve the issue that's causing the pain. So we continue to live in pain, take the medications, and until the medication wears off, we feel somewhat better, or until the complications or side effects start from the medications, we feel better. So eventually we end up having tests, MRIs, CT scans, X-rays, EMGs, and frequently they don't show anything. They come back and they say, well, good news, there's nothing wrong with you, but you're still living in the pain. Now, it's good to know, especially in the case of somebody who has anxiety or fears about a particular disease process, like, say, cancer or heart disease, it's great to know that any disease has been ruled out, but you still don't know the cause of that pain. Why do I have this unpleasant sensation that keeps me from doing the things that I need and want to do? So your expenses go up because they do more tests, you have more medications, you miss more time from work, and you end up getting depressed. Depression is known to cause increased pain because you're not moving. You get weaker. When you do move, you get more pain because your muscles aren't able to support the body parts and areas. And as a result, you keep going around in this circle, getting more pain, more expenses, more muscle tension, more depression, until you just get so frustrated, and so does your healthcare provider, that nobody knows what to do or how to stop this process. We've been erroneously taught in our society and culture that answers come from outside ourselves, other people and things, rather than looking inside ourselves and beginning to monitor, what are my variables? Do I do things that contribute to this pain that I'm not aware of? And can I change those things? We've also been taught that answers should come from the inside, or answers should be immediate and should not require that much effort on our part. I kind of call it the pill society. You know, if you take a pill, it's going to go away. And many times it does, but over time, the pill no longer works. We need stronger pills. And the relief isn't as immediate. I'd like to introduce you to some steps that you can begin taking immediately following this module to break your pain cycle. Number 1, top of the list, is taking some responsibility for yourself. Now, I'm not going to tell you that's always easy, but it is always worth it. And that is to start looking and thinking about your pain a little bit differently. That's why I wanted to spend that time and define pain for you and explain why and how pain acts and is categorized in healthcare. Because I think these things will start to help you understand that you have more power than you think you do, or that you've been taught that you do. So number 1, make small and simple changes. The things that I'm going to discuss both in this module as well as future modules are some small and simple things. You don't have to make every change that I suggest in every module immediately. You're going to have access to the modules in the future. And in addition to that, you're going to have the personal group coaching calls so that you can ask questions and get information. Be consistent over time. It's so easy to go on a trip someplace for the weekend or have relatives come and visit, and we take 3-4 days off. This isn't necessarily a bad thing. Sometimes taking a few days off helps us realize how much those small and simple changes we've made profoundly affect our pain level. But get right back into the game. Don't decide, well, I took 4 days off and now I'm feeling bad again, so I'm just going to quit. No, say, wow, I can't believe the difference those small and simple steps made for me, so I'm going to get right back on it today. Typically, it only takes a day or maybe 2 to make up for missing 4 or 5 days of doing your activities that help diminish your pain. So in spreading that out over time and understanding that you are going to miss a day here or there and not be perfect in doing it 100% of the time, say, wow, I learned something important and valuable, and I'm going to keep going. The other thing is if you don't backslide and you take 2 or 3 days off, know that wow, these steps have really made a difference to the point where I can safely take 2 to 4 days off and I still feel good. That is a terrific gain. So congratulate yourself for that and know that you're probably ready to take some more small and simple steps in your program. Use methods which affect your entire system. Now, not every method is going to affect every single thing in your system. That's just a reality. However, when you look at a method and whether you're going to try it or not, look at how many systems or how many body parts that affects. The bigger effect that technique or method has on your body, the better. An example with this would be, am I just raising my arm up in front of my face and calling it a shoulder exercise, or am I engaging my whole body by using my core muscles to support as I lift up my shoulder? I'm certainly getting a lot more of me involved, and typically I see the best results with people who are involving their whole systems rather than parts and pieces of parts. Principles that carry you forward will frequently set you free with small adjustments and additions. So what does that mean? When you find a true and correct principle and you keep practicing it with consistency, you will start to see a decreasing pain level over time. And I'm going to show you something in the next slide where I define this a little bit more clearly, and how you're going to decide what the true principles are or best principles are for your body and whole being. So try principles that connect the mind, body, and spirit. So when you are choosing these activities, yoga is a good activity that connects these things. You just need to find a teacher who's teaching at a level where you can begin. You also want to be present mentally. So instead of showing up to the exercise class, or instead of showing up to the doctor's office and plopping yourself on their table or their exam room and saying, "This is my problem, fix it," say, "These are some problems that I have that I would like some additional help with. These are things that I've done. These are results that I have gotten doing these things. So now I'm looking to take the next step. Can you help me with that?" The more proactive and the more information you can provide any healthcare provider that you go and see, the better results you're going to get. Now, if your healthcare provider isn't appreciative of that information, you might be looking for another provider. But nonetheless, you want to connect your whole self in getting those benefits. So establish a baseline and set some goals. The baseline is so important and powerful. It's where you start. So if you haven't done that already, get out your tracker journal and fill out those baseline pieces of information. And I'm going to go over that right now in more detail. When we establish a baseline, we are able to determine where we started. Now, it's hard when you live with a symptom or a problem or an issue 24 hours a day, 7 days a week, or it's a very regular symptom, to know if it's changed at all. We tend to look for these huge, giant leaps forward. And in reality, our steps forward may be 3 steps forward and a step back, 3 steps forward and 2 steps back. It isn't a smooth line. I've never had an experience in life where everything was a smooth line just because I wanted it to be. But if I was consistent and kept picking away at it, I eventually achieved that which I set out to do, even if I did have to modify my course a few times. So when you complete this, I call it the pain and gain sheet, write down your name up here in the top. Then write down the symptoms on the left-hand column. Now you may need more than one sheet, and that is fine. You can use as many sheets as you need to complete all the symptoms that you want to write down. Also keep in mind that the symptoms don't have to be related to pain. Remember, depression was on that pain scale or that pain cycle. You can also include anxiety, fear, brain fog, inability to concentrate. So be generous with yourself in thinking about what would I like to change so that you can track how you're going to do that. The boxes across the top, along the same line as the box that says symptoms, are for dates. You want to keep track of this information, but you don't want to track it every day. It's like going to a weight loss program, and every single day you're weighing yourself. So you get hormonal changes, you get weather changes, you get every tiny little change in the environment. So when you monitor your symptoms one time per week, like an appointment that you set in your phone or in whatever schedule you use, so that you sit down with yourself and spend some time writing down where those symptoms are at. Take an average over the week before you even sit down and look at the last week's numbers, so that you can see, have my numbers increased, decreased, stayed the same? And use several different monitors, including intensity. Was the pain less intense? Was it less frequent? Happening less often? When it happened, did it last for a shorter period of time? So it lasted less time and went away quicker. All of these factors can be tied into those activities in order to come up with that average over the week to help you understand how to give yourself the best number that you can give, keeping in mind that these numbers are based on all of that conscious modification that goes on. But nonetheless, these are your personal numbers so that they can help you know, am I going in the right direction? This kind of a sheet is great to look at when you're feeling discouraged and you're like, I don't know if this is doing me any good whatsoever. You start going back and looking at your pains and gains sheet and realizing how much progress you've made since the beginning, which is another important factor. Compare from the beginning to where you currently are on a weekly basis. Don't just compare to last week to this week, because things happen in life and it isn't always a smooth path. The numbers are the lines at the bottom of the sheet that are written in diagonals. Those can include things that you have done or changed in order to see how that affects your numbers. So some of these things might be as simple as drinking more water, which I'm going to talk about in a few minutes. And every single week, you don't have to add something new. In fact, I don't even encourage you to add something new every single week. Add something every 3-4 weeks or so that you have, each time you add something, you get a good idea as to how that is positively or not impacting your goals, which is to get down to 0. Now that brings me back to grading of the symptoms. Each symptom gets a grade on a 0 to 10 scale. 0 is no pain or problem or symptom issue, and 10 is really severe. I either needed to call an ambulance, or I would have called an ambulance if I thought they would have helped me, or it was just so severe I really couldn't function at least some of the time during that week. So that will help you establish those numbers so that you can be clear on which direction they're going. The other thing is there's another section in your tracker binder which enables you to look at some comments, some thoughts, some feelings on what it feels like to go through this process and this journey. What experiences are you having? What miracles are you seeing? What feelings have you become aware of that you may not have been aware of before? Like, what does it feel like to take care of me on a regular basis? What does it feel like to be on my own priority list? And what behaviors do I see changing in my family members or coworkers as I start to take care of myself and do some of these things to help me? To record those is another really positive way when you're feeling those moments of discouragement to go back and review and say, oh, I forgot about this day where I felt, so positive about taking care of myself. And I was really connected into how much better I looked or how much better I felt. Because every day is not going to be a great day. Before you started having pain, every day wasn't a great day. Some days you wake up and you're like, wow, I feel like $1 million. I'm going to take on the world. And other days you wake up and you go, I got to drag my little hiney to work today. So, keep in mind that those ups and downs aren't going to go away just because you're taking action to have more ups and to have higher ups. It just means that we're realistic that some days are going to feel like I need a little bit more encouragement. And so I've got something to look back on, and I've got something and some place to share that information with so that I have it for the future. This is a very powerful tool, and I really encourage you to use it. So let's talk about some additional tools that help make a difference. Again, in future modules, I'm going to go into a lot of detail about some of these tools. and methods to use them, and methods to tweak them to make them more usable for you and your body. However, today I just want to give you an overview because this is going to help you as we proceed through this process to know some other things that you might be able to do because the whole group hasn't caught up with you. The module isn't available quite yet. So number 1 is water intake. So I'm going to keep this brief and tell you that the optimal amount of water is 1/2 your body weight in fluid ounces. So what does that mean in real numbers? In case you're not a math whiz, that means if you weigh 150 pounds, you would drink 75 ounces. If you weigh 180 pounds, you would drink 90 ounces. So you take your entire body weight in pounds, whatever that is, divide it by 2 in half, and then put ounces on the end of that, and that's how many ounces you want to drink. A cup in your kitchen, meaning a measuring cup, holds 8 ounces. So take a container, your favorite drinking container, and figure out how many ounces of fluid fit in that container and how many of those you need to drink per day to reach that number. I will tell you this is a number that you want to achieve gradually, not in one day. But you could even start by measuring how many ounces of water you're currently consuming. Water is essential for health of tissues and cells in the body, for our blood pressure, for our spleen, pancreas, liver, kidneys, pretty much everything. So don't underestimate the power of consistently drinking an adequate amount of water. If your body has been accustomed to you not drinking enough water, again, you want to gradually increase your intake of water so that you are not becoming water filled. The other thing is you want to stop drinking water at about 1 gallon a day. So if you weigh more than 250 or so, you want to stop drinking water at 128 ounces. Drinking more water than 1 gallon a day starts to deplete your body of needed electrolytes, which are salts and colloids, and your body needs those. So stop at about 128 ounces. The other thing is consider your environment. Do you work? Do you sweat? Are you outside a lot? You may need a little bit more water than half your body weight in fluid ounces. But by keeping your body clean and flushed, you're going to feel better. So number 2 is breathing. Breath is very powerful. And the most common statement I get when people hear me say breathing, they go, "Oh, I know how to breathe." Everybody thinks they know how to breathe. I've been studying and using breathing to control pain for at least 25 years. And I still discover new techniques and new methods of breathing that I go, "Wow, I didn't know I could do that. That was really awesome." So breathing and knowing how to breathe helps you to connect to your body at all levels, physically, mentally, and emotionally. So you can slow yourself down and focus. And there are a lot of different breathing techniques on YouTube. I am currently in the process of putting breathing CD together, which you will receive so that you can also put this on MP3 and carry it with you anywhere you are at in order to help increase your awareness of your breath and increase the power of breath in your life. So then, mental and emotional focus, including doing a body schematic and journaling. Now, a body schematic is a specific technique you're going to learn in the 3-day workshop, and there will be a guided process of this on the CD in order to help you understand and know how to do this body schematic. But also using your journal to write different things down about how you feel, noticing how you feel and how that correlates with different pains in your body and different experiences in your life and your health. Movement. Movement is powerful and important. Helps keep our bodies moving, fluids circulating, even when we're in pain. There were studies done with rheumatoid arthritis and with multiple sclerosis showing that those individuals who exercised at whatever level they could move were able to function longer through the day and were able to get more done during their hours that they were able to function because of doing that exercise. So even if you don't think, well, I can't go and do CrossFit or I can't do an insanity workout, there are workouts out there that can help you move and begin to change that process, because as you move and get stronger, you can increase your exercise and your movement activities. So it is a self-perpetuating spiral going in the direction of gains rather than in pains. And you will get movements at the 3-day workshop. But there are also other movements and other places where you can find out about movement, and I will be doing a module on that. Nutrition. I'm kind of a balanced person as far as nutrition goes as well. I don't really believe in completely eliminating food groups or food items per se. I think that there are things that are much better for our bodies and things that aren't as good. But when we're first starting out, one of the most important things to know is the more alkaline your diet is, the more towards base your diet is, which are the higher numbers, by the way, like 8, 9, and 10, the more inflammation and swelling your body is going to get rid of. So you want to eat foods and meals that are high in alkaline foods. The more acidic your foods are, typically the more pain you have. And we look at the alkaline foods and we think, those are a lot more work, but really, you feel so much better, you don't even mind doing a little bit extra as you start to decrease eating some of the acidic foods. Most of the acidic foods tend to be the easier to grab, soda pops, French fries, those types of things. But most of our pain is caused by too high acid in the body, specifically around the joints, in the muscles. And when that acid-base balance inside our body gets off and pull towards acidic, we have more pain because we get more inflammation. And as we start to go towards an alkaline diet and an alkalizing diet, we start to feel better, have less swelling and inflammation in our tissues, and have more energy. There's also professional coaching. Now, you've signed up for the 3-day workshop and you're getting the personal group coaching calls as well as these modules. So you are getting professional coaching. But you can also get one-on-one coaching from a variety of different professionals. Be sure to try out different professionals in any category or different programs. Check them out before you make that final commitment so that you can find out what services are offered and which ones you feel will support you the best as you take steps towards better balance in your life. I know that you are serious about your health. You signed up for a workshop, you're watching these modules, and you're going to join me on coaching calls. So if you're serious about being alive and not just living, and again, I know you are taking steps. You have committed to learning and doing something new, evaluating the results, and making decisions based on what you want and the results that you are getting. Again, keep in mind, when you make these small and simple changes and they become habits for you, you're going to start to realize how much healthier you can be. No one cares about your health as much as you do. So I invite you to continue to step into balance. I'm Mary Thomas Miller, and I thank you for listening to module number 1.